So as we reported in the previous hour, we've seen some very violent scenes outside a number of hospitals this week, with NAHAWU and members of some other unions on strike. One story in particular, though, has shocked a lot of us. Reports today that an IPSS Medical rescue ambulance carrying a girl in a critical condition was stopped by protesters outside a hospital in Stanger. Now, we understand the striking workers tried to pull the child from the ambulance and assaulted a paramedic. Well, Keith Pillay is IPSS's medical operations manager. He was at the scene when this incident occurred in Stanger, and he joins us this evening from Belito. Mr. Pillay, thank you very much for joining us. I wonder if you could just explain exactly what happened. We understand this was a young girl in an ambulance heading into the hospital.
Hi, good evening, ma'am. Yes, that's correct. So basically what had happened was we attended a call within our area of operations, and the child needed an advanced life support intervention together with the ambulance. And we had then decided to transport the individual through to a facility within the area being Stanger Hospital. However, on arrival to Stanger Hospital, we came across a protest, which at that time was peaceful. When entering Stanger Hospital, an individual had approached the ambulance and started tapping the ambulance window with a panga. So whilst doing that, the paramedic who was currently driving the ambulance had then dropped the window down and asked for the individual to stop doing what he is doing. And whilst doing that, another individual had returned from the back and assaulted one of our paramedics. However, during that time, it was suspected that, as per what they say, it was suspected that we had been transporting staff to and from the hospital. But when opening it and realizing that there were no employees in, that's when they became upset with our employees together with the patient, and insisting that there is no staff to treat the patient initially. But at the end of this, we still got into the hospital and the kiddie was attended to as she was in a critical condition.
So before I get more details on what actually happened, how is this young girl? How old is she?
The patient is a minor. She was being accompanied by her sibling. She is currently in a stable condition as from the last time we did get a report on.
Okay. So the person who tapped on the window with a panga, was it definitely a striking worker, or is it hard to say?
From what we suspect, yes, it is an employee of the hospital itself.
And they were concerned that the ambulance was trying to bring staff into the hospital? Did I understand you correctly?
That's correct, yes, ma'am.
So explain to me why, when they realized it was a child in distress, that they still continued to be angry and then assaulted the paramedic. What happened there?
And in fact, ma'am, just to correct you there, the assault did take place before opening and actually having a look at the ambulance, attacking our staff and affecting the patient as well.
Okay, so they attacked the paramedic, obviously thinking that inside the ambulance were people trying to get through the strike. They open the ambulance. Yes, they see this child clearly in terrible distress. We've heard reports that they tried to pull this child out of the ambulance. Did that happen?
Yes, that's correct. But luckily enough, there were some staff members who still allowed us to go in and avoided the matter from escalating.
So I don't understand this. When you can see that there's a child who's very sick, why would, on opening the van, when you realize it was a legitimate emergency, why would you try and pull the child out? What was being said at that time?
That's what we failed to understand as well, ma'am, as it was a crowded area and we had a few people who actually wanted us to complete what we were there to do. And yet there were a few and particular individuals that refused to allow us to do what we are there to currently do.
So when you say there were people who wanted you to get through and people who didn't, the people who wanted to let you through, were those also striking workers? Were those people among the striking workers?
Yes, that's correct, ma'am. Being the hospital that we visit on a daily, it's within our operations, our areas of operations, and we visit this facility daily and have good working relationships together with the employees of this establishment. So even to us, this came as a surprise.
Okay, so I'm trying to understand this. The people who were striking, do you know these people?
Most of them, yes, by sight, because we do see them on a daily basis. And yes, a few individuals, that's correct. But this was as a whole, as I say.
So who was trying to stop you? Who was trying to get you through?
Individuals, the protesters themselves, part of them, yes, it was a peaceful march, and until that particular individual tried to cause a stir by damaging the vehicle approaching the hospital.
I see. So am I correct that there were a few individuals who were trying to do something that the rest of the protesters were saying, no, you cannot do this?
That's correct, ma'am, yes.
How did the situation come under control so that eventually you were able to get through?
So eventually I did speak to a few individuals together with the SAP members, and we managed to calm down the situation and come to an understanding and agreement. And guys, yes, as much as this is something that you guys are looking for and you guys need attention with, we have decided that yes, this kid does need immediate attention and it does need the facility of Stanger Hospital to do so.
Was this child conscious during this?
Yes, that's correct, ma'am. Kitty was conscious.
How frightened was she?
Due to the circumstances and the diagnosis, at that time, it was more the medical attention that was being sought.
Okay. You're a private ambulance service going, and this was a government hospital, am I correct?
That's correct, ma'am, yes.
What is, I was going to ask you where the police were. Clearly, police were on site because you said they did try to help deal with the situation that was looking pretty rough at one stage. What is the situation now regarding your ambulances? Have you been reassured that you'll be able to safely get through with other critical patients? What's going to happen tomorrow if you arrive with another patient who's critically unwell and try and get through?
The issue has been dealt with by various members from IPSS Medical Rescue together with the Department of Health and the hospital. So by the looks of it, things should be calm and we would be able to access the facility. However, we can't determine if any unforeseen circumstances can be dealt with at this stage.
Okay, so it's still somewhat risky, but you've been given some assurances. I have to just go back to this because I don't understand. You say that there were a couple of people who tried to pull this child out of the ambulance. Am I understanding you correctly?
Yes, that's correct.
Did they manage to pull her out?
No, not at all, ma'am. It wasn't allowed to happen.
Okay, so how did you stop it?
Initially, it was the advanced life support medic that was sitting with the patient at the back of the ambulance, and we as individuals and medical professionals aren't going to allow that to happen, and the individuals who assisted us afterwards also did not allow that to happen.
I want to ask you a question. I mean, it's an astonishing story, but also, if we think of what the medical world has been through in the last 3 years with COVID and how in many cases doctors and nurses are absolute heroes and dealt with so many difficult situations. We also know that the situation at government hospitals is really tough. There are just never enough resources. There's a certain amount of sympathy for staff who are saying, please, we need more money. But as someone who interacts with staff all the time, you know them, how did you feel about what happened today?
Apart from everything else, I'd say disappointed, as us being medical professionals and help people on a daily basis. Most of the time, yes, with medical relevance. However, when we do help people on a personal level as well. And I can easily say that Stanger Hospital, being one of the best hospitals within our area, just did come to us surprise.
Thank you so much for speaking to us this evening, and I'm very pleased that at least this child was not, her condition was not worsened by what she went through, that the medical personnel were very quickly able to calm down those individuals in the crowd, it seemed, who were trying to pull her out of the ambulance. And let's hope she makes a full recovery. I really appreciate your time. Thank you so much. Keith Pillay is the IPSS's Medical Operations Manager. That's the reality of what is happening on the ground. Now, we have to put this in context. There were people striking who clearly realized that it was not okay to pull a child out of an ambulance, who managed to deal with the situation along with the paramedics and then the police. But the reality is, this is a situation that is highly volatile. And this is just one story. There are a lot of stories. Pillay Hospital in Bloemfontein in the Free State has had a number of incidents. We've heard of a number of incidents today as well outside Charlotte Macleay Hospital. But anyway,